Hello, everyone. Welcome to the TRT and Hormone Optimization YouTube channel. I'm your host, Danny Bossa, joined today with Dr. Jeffrey Ruterbusch. How are you, Jeff?
Fine, Danny. How are you?
Very good, thanks. So today's topic is going to be things to look out for when you are starting up with a new TRT clinic or new doctor, maybe things to be beware of, things to check out, things you want to be careful about, because there's a lot of these TRT clinics that are just popping up all over the place. Every single doctor and their grandmother is trying to get into this TRT business. The vast majority of them don't know what they're doing. So Dr. Jeff here wants to discuss some of the things you guys should look out for. So Jeff, the floor is yours.
Welcome to this channel. I am Dr. Steven de Vos, the Lifting Dermatologist, and this is my partner Danny Bossa. If you want to learn more about the most cutting-edge science-based information in the world of hormone optimization, please like and subscribe. I also invite you to join my other YouTube channel, the Lifting Dermatologist. The link you can find in the description of this video.
Thanks, Danny. Okay, I'm going to speak to you today about a subject that's near and dear to me because I've been involved with it, and now I'm going through some difficulty with the transition. So the topic today is basically what you need to be wary of or cautious of when you go into a men's health clinic, or either for erectile dysfunction, immature ejaculation, but in particular, if they advertise testosterone replacement therapies, or as we like to call it now, testosterone optimization therapies. I currently reside here in Jacksonville, Florida. And if you're not familiar with Florida, it's rife with a lot of T mills, like testosterone mills, and men's sexual health clinics that will advertise testosterone replacement therapy as an adjunct to their therapy for erectile dysfunction. When I first started doing this, I came aboard back, well, now 4 years ago, with a very reputable company called Pinnacle Men's Health. It was actually owned and operated by some investors that knew there was a niche, there are riches and niches, in men's sexual health. The owners had open clinics in Michigan, St. Louis, Tennessee, South Carolina. So they had 5 or 6 booming clinics that were doing anywhere from $200,000 to $250,000 gross per month. So the hedge funders purchased this company thinking that, boy, our plan is to grow this business and to maybe 50 to 100 more clinics in the United States in the next 2 to 3 years. So we were doing very well. There was the owner was a reputable businessman who had an MBA, who had a history of knowing how to grow businesses, make them profitable. And they also knew that if they hired me as the physician, I could have autonomy to run the clinic side as I saw fit. So we were doing very well. But the market here in Florida in particular is so now saturated with these men's health clinics and these testosterone clinics that the goal of the hedge funders that had this company, it didn't reach fruition. They wanted to grow it quicker, and they wanted these clinics to make $350,000 a month, which it didn't. So therefore, the hedge funder decided to say, listen, it's not worth our investment. We're going to sell it. So I had almost 5,000 men paneled to me in almost 3+ years, 3.5 years of doing this. And I developed relationships with, had on testosterone therapies in addition to other offerings we had for erectile dysfunction and premature ejaculation and the Priapix shot. I think I discussed this before, but back to the business at hand. We were purchased back in June by another fellow who's simply a businessman. And he has a history as a broker. He has a clinic in Maryland, and he has a history of doing some business with a doctor down here in Florida that, a decade ago, was opening a bunch of these clinics, made a lot of money. But then the physician lost his license because they were doing minimum amounts of blood work, no blood work, just terrible charting, just doing things the wrong way from a medical legal perspective. And the whole goal was the bottom line, profit. So the physician ended up being sued, and he lost his license to practice medicine here in Florida. He wasn't doing appropriate labs, as I mentioned. He wasn't doing appropriate chart work. He was seeing patients and not even establishing them as patients. So back to the clinic that was my clinic that was purchased by this fella. He has a business background, and when he came in, he told us, listen, do as I tell you and don't ask questions. That's a red flag right there. So what this guy does is what a lot of these clinics here in Florida are doing is these clinics are opening up so fast, some are failing. And these people will come in, these businessmen will buy the business with only one interest, and that's to get the database. They want those patients, those several thousand patients that the business has acquired. Those patients do not belong to me. They belong to the businessman who owns the business. So even though they're my patients, I've developed a patient-physician relationship. On contract, they belong to the business owner. So things to watch out for. If you go to a men's clinic, one, it doesn't appear very professional. Okay, you can tell by the ambiance and the furniture and so forth and the facade of the building. Usually these clinics are staffed by men. The business model calls for that because for some reason they research it, and if a guy walks in with these erectile dysfunction issues and sees a woman, he just might just turn and just not say. So I understand. So I would recommend any male here that's interested or is currently with a clinic has suspicions. One, do your homework, research or find out who the owner is. If you Google search the owner or the vice president and you find out these people have an unethical background because it's public knowledge, if you Google search them and there's some issues in their background, I would definitely do that because that can tell you a lot about a person's ethics. If you get a phone call from someone that you don't know because your clinic that you were seeing and paid big money to just folded, and oh, by the way, many times guys will go in and lay down several $1,000s for a year package. A month later, the doors are closed. So if you get a phone call from someone that you don't know and they tell you, hey, I'm so-and-so from this clinic and I have your health record here. Red flag. That just means that somebody has purchased the database of the clinic that's closed, and they're going to be calling you up and saying, are you interested in continuing your care here, with this new clinic? And if you've spent, $1,000 or $2,000 for the year and you only gotten 2 months worth of services, we'll give you a little discount bring you on board with us at as I say, a discounted rate, and it makes you feel like, oh, these guys are interested in, in me, because many times these people are smooth talkers. So therefore, you may go into these places, and if they only do minimum blood work, in other words, a PSA, a total testosterone, and say an estrogen. A lot of these places, that's the only three things they will do. And by law, here, at least in Florida, black and white, the physician lost his license by doing that alone, amongst other things. There were some patients he had impaneled to him he had never seen. So there are some basic labs that they must draw to have a bona fide, legitimate clinic in Florida. And that's the usual total testosterone, free testosterone, CBC, which will track the H&H. Estrogen is controversial. A lot of people will measure it because it's still there. I currently use it just to make sure it's not too low. You should have a fasting lipid panel and a complete metabolic panel initially. Doesn't have to be that way for follow-up labs. But red flag one, you get a phone call from some company that says they have your health record there and they're interested in helping you, but you don't know who they are or never heard from them. That's a red flag. If you go in and it appears kind of sketchy, kind of seedy, because these places tend not to invest in the accoutrements that make a place look professional. They'll just minimum, no televisions. Like we had ESPN on flat screens everywhere. Like a man cave kind of stuff. A lot of military stuff too, because this is a retirement area where a lot of military have retired. So we may look like a lot of nautical stuff and Navy stuff. But you can tell walking in. And also, as I said, if they do not do the appropriate lab work and be inquisitive. A lot of the guys who watch these podcasts know about some of the labs that we discuss frequently. And if you know that they're not doing those labs, ask them why. And if they can't give you a good reason, do not invest monies there. All right. Also ask them, may I speak to the physician? Because many times they will advertise they have an expert staff on board, a physician. But the business model here in Florida now is turning towards hiring ARNPs or PAs. So ask the doctor who walks in and say, sir, are you a physician or are you a physician's assistant? Because you, as a patient, have the right to discuss your issues with a physician. And if they don't have one on staff, that's another red flag. They don't do the appropriate lab work, that's a flag. Also, ask them about the importance of tracking lab numbers versus symptoms. Many people will come in and they'll say, the doctor told me that my testosterone was, over 800, so I'm fine. Well, if they're not doing an Adams score or symptoms, they're not interested in doing things the right way. If they're solely focused on total testosterone only, you know they don't know what they're doing. Okay, so then ask the clinician or whoever presents it, but even if it is a physician, say, what are your goals for optimizing? Because again, you guys who are watching this, you know what we're looking for. You know that how you feel is much, much, much more important than what the lab values show. All right. If you're involved with a clinic, and you have problems receiving your product, meaning testosterone, that's a red flag too. Now, sometimes there's supply issues, something gets lost in the mail. That's rare, but it does happen. But if that's the norm, then that's a red flag, because many of these people that get into this business have done this so long, they've run up accounts at different pharmacies and they haven't paid their bill.
Yeah.
Therefore, they have to, so the pharmacies do no longer accept business from the person. So the business person then has to open many accounts with different pharmacies and keep shifting his allegiance to those pharmacies that will do business with him. There's the biggest dispensing compounding pharmacy here in Florida is Olympia Pharmacy, Orlando. So I would recommend that you inquire as to which pharmacy, this testosterone replacement therapy clinic that you are attending or think about going to, does business with. And then Google search and research that pharmacy. You have to do your due diligence so you're not left holding the bag after investing several $1,000s, and then you show up 2 months later with maybe 1 or 2 treatments, and then they folded, gone bankrupt, and you're out money. Because they are folding left and right here in Florida right now because of the numbers. When we first opened up Pinnacle Men's Health 4 years ago, we were the lone provider of this niche here in Greater Jacksonville, which, oh, by the way, is the largest city in the United States, not population-wise, area-wise. But then within 2 or 3 years, we have several now significant other companies penetrating the market, and therefore the business tended to die down because the market was becoming saturated. So these are things I want you to be cautious of. And so in summary, check out the ambiance. Did they call you and say, we have your health record, we have your file with us, and we'd like you to come on board with us? Ask the provider there if he is a PA or a physician, because they're supposed to tell you that when they walk in. A PA walks in there, they're supposed to introduce themselves as a physician's assistant and say, sir, if you would like to be seen by a physician, they're supposed to tell you who the oversight physician is, and then you, as the patient, can say, well, I'd rather see the doctor, and then you can reschedule your appointment with an actual physician. Many of these clinics will advertise that they are men's sexual health experts, our medical staff are expert physicians, and they're not. Most of these guys will treat everybody and as a cookie cutter solution. In other words, this company I'm aware of, and there's others, they treat every man with the same prescription. In other words, every man gets 100 milligrams IM twice a week. That is, I don't care if you're young, old, dialed in, not dialed in, what's going on. They will write the same prescription every time. And so that just tells you another thing that, and you wouldn't know that necessarily as a patient, but if you can find other patients there, you know, who are going to the clinic, and ask them, hey, what is your testosterone regimen? 100 milligrams IM twice a week? Yeah, that's mine. What's yours? Same thing. Well, it's called Joe, it's called Bob, it's called Bill. Same thing. It's cookie cutter medicine based, with the sole purpose of enhancing their bottom line, not necessarily in your health and wellness. So that's basically what I want to say to you today, is just be very cautious. And it's, like I said, I'm going through it right now because we were doing legitimate business for 3+ years. We got bought out, and then I was recognizing the fact that the ethics of the business were deteriorating, and I just did not want to compromise my ethics for a businessman's profits. Okay, that's basically what I have to say. Now, if anybody has any questions, either if we're live, Dan, you can ask some, or we can just post this, and people may want to, type in questions about their concerns to me, and I can answer them.
Yeah, absolutely. This particular video isn't live. It'll be posted after, but there's going to be obviously people commenting on YouTube. It'll be posted in our Facebook group as well. To those of you watching, Dr. Jeff is in our Facebook group. The Facebook group is called TRT and Hormone Optimization, exact same name as the YouTube channel. Anybody with a Facebook account is welcome to join. You can even create a fake Facebook profile if you really want to, just to do this. We don't really care. All we ask is you answer the 3 questions that get asked to you at the beginning, just to show that, for you to demonstrate that you have a genuine interest, because there's just a lot of people who just click on random groups all over the place to join. And that's really about it. Dr. Jeff is there. And yeah, it's very similar to, like, I just did a video about this yesterday of, if there was some cookie cutter protocol that just worked literally for everybody, we wouldn't need a doctor, we wouldn't have the channel, we wouldn't have the group, we wouldn't do anything. It's like, take 200 milligrams a week and get your estrogen here and your DHT here and your SHBG here, and that's it, and you're done. But it just doesn't work that way. Everyone asks us, what should I be taking? It's as much the doctor that's going to guide the patient as much as the patient that will have to experiment a little bit on his own to figure out, where do I feel good? And that answer is going to differ for everybody. So if they're just giving, you said cookie cutter protocol right off the bat and just leaving you like that, that's definitely going to be a red flag. So great advice, Jeff. Anything you'd like to add, or?
Well, I don't know how many people on this forum have gone to these clinics, but I would imagine a lot are going to testosterone optimization clinic. We have one down here, Live Like a Viking. They're going up everywhere. There's other testosterone optimization clinics. But it's just do your homework. I mean, you have every right as a patient. No, by the way, these packages are not cheap. They're usually several $1,000s for 1 year, which they offer, the erectile dysfunction medicines, or if you have PE, they'll offer you that. They'll offer you acoustic wave therapy for ED. They'll offer you testosterone therapies. They may even offer PRP shots. These are just platelet-rich plasma that we just draw off your arm and spin it down and put the platelets in the penis. That's to help with angiogenesis or neovascularization, to help develop better blood flow. That's what the erections are all about. But again, this podcast is mostly about testosterone and the fact that these clinics are burgeoning so quickly here in Florida in particular. You have to be cautious, because just as frequently as they're going up, they're going under.
Here in Canada, I'm in Montreal, Quebec. It's a very different landscape. I can go see any doctor. I can go see a regular GP that's covered by medical insurance. I mean, typically those guys really don't know much, and trust me, I've tried to find one back in the day when I started, and there wasn't. Or you can go private and you pay the fee, maybe $150 for the consult or whatever. They'll draw labs. You can go get your labs done at a local hospital for free, because the Medicare system here covers that. Or you can go to a private lab and just pay for it out of pocket if there's specific labs that you want to get done that you can't get done at in the hospital. Or maybe you have a specific type of test, like. You could let's take estrogen as an example. You can either measure the regular estrogen test that women take, or maybe you want that ultra sensitive assay. Well, that you'd have to get it subcontracted to, like LabCorp in the US. But once I get my prescription, I'm free to go to whatever pharmacy I want and get my meds. And I go straight to a pharmacy. It either could be a compounding pharmacy or it could be a regular pharmacy, and I just get my meds and I go. If I get sick of my doctor, I go somewhere else. There's none of this contract related yearly fee, pay monthly, pay yearly, and then you're stuck in like you're on a contract like with Netflix type thing. Here it's really a pay per use type thing, so it's a lot easier for a patient like me just to pick and choose where he feels like he's getting the best care. So what happens now for guys that are under contract with that clinic and developed a personal relationship with you, or a good relationship with you, and now you're not there? The clinic owns the patient, so to speak.
Right.
But as myself as a patient, I'm going to pick and choose who I want to deal with. So what position would that put a guy like me in, where I'm like, okay, well, now I've paid this clinic X amount of $1,000, but I went because I specifically wanted to deal with Dr. Ruterbusch, but he's gone. So now it would be a matter of, well, do I just continue with this clinic anyway because I've paid for it and it's expensive? And when my contract is up, and then I can try to go find where Dr. Ruterbusch is practicing now, or I lose my money and go straight, right?
That's a good point, Danny. I'm glad you brought that up. Well, a lot of these guys have paid big money, and once they have now, or are going to find out, are finding out that I'm no longer there, because I haven't been there since the 17th day of December. So most of them are telling me, well, I'm not supposed to call them up and import doing them. Hey, come on board, because my contract is not my pay. But a lot of people are telling me, Doctor, geez, if you step off, let me know. Once my contract is up, I'm going to get the meds and products that I purchased, I will seek you out. So that I'm out, and of course, I would love for that to happen, because I really enjoy taking care of men's sexual health, and optimizing hormones. I spent the last 31 years doing this. So, and again, I'm not bragging, but I just have a lot of experience with it, both as a consumer and now as a physician doing this. So, yeah, hopefully, men will just, find out, Google search me. Some are finding me as a result of the podcast already, and, just trying to be out here in Florida. So, yeah, good question. I'm just hoping that some of these guys will be able to, and then just jump ship and seek me out. Either most of them, since they've already spent the money, are going to wait till their contracts are expired. Now, one last thing. After December the 18th, one day after I left the clinic, Florida passed a new law. Any controlled substance. Now, this is mainly for opiates. But any controlled substance. We all know testosterone is a controlled substance. It's a Schedule 3. But any controlled substance now that's dispensed by a physician has to be entered in E-Force. E-Force is a new huge database that the DEA has implemented to track patients' consumption of opiates as they doctor shop. Yes, again, it's for opiate consumption. Make sure they're not doctor shopping, getting a bunch of stuff here and a bunch of stuff here. But it is a controlled substance, and the E-Force does say that if it's a controlled substance, it has to be entered in E-Force. So again, to the guys who are involved with the clinic or thinking about it, especially here in Florida, ask them, are you now entering my testosterone medications through this new E-Force that the DEA has now implemented here in Florida? If they haven't or don't know anything about it, another red flag, because it became a law now here in Florida as of December the 18th. It must be done. Okay.
Unreal. Because then you start thinking, well, will they judge based on dose specifically? There's guys out there, like, as you know, that'll take 100 milligrams a week and they've got like crazy high levels. And you get other guys, let's say like me, I can take, 250, 300 milligrams a week and my levels are the same as a guy taking 150. are they going to base it on, well, this guy's taking more than this guy, so this guy's doing something wrong? Or are they going to also verify what levels are being established with said dose?
Yeah, a good question, Benny. And as I said, the E-Force mainly implemented because of the opioid crisis, especially, I mean, before the tea mills were opening ad nauseum here in Florida, the pain clinic mills, the opiate mills were opening. Florida was a state that's rife with pain clinics where they hire some doctor, just sits in a box and just strokes, prescription after prescription of oxycodones or Percocet or Lortab or Norco. And they're springing up left to right. But as they clamped down on that about a decade ago, and then the tea mills are now flourishing. And again, where there's money, there's gonna be the feds and rules and regulations to follow. It's unfortunate that testosterone is a controlled substance. Oh my gosh, it's almost like we live in an androgynous society, but it is. So again, it's just a red flag. If you're now with a clinic that you may think's reputable, ask them, are you now entering my testosterone in E-Force? Because like I say, it's something new. And a lot of people don't know about it. Even the legitimate clinics don't know about it. So ask them, make them aware of it, because guys will come in and close them down. And again, ignorance is no excuse.
Absolutely.
Absolutely.
Absolutely. And hopefully, like, they're going to know something of these things and not just base it on one single number. Like the example I just used, if you got a guy who's taking, 150 milligrams a week and gives him a free tea of 75, and you're getting another guy who's on 250 milligrams a week, but he's got a free tea of 25.
Yeah.
Who's abusing? Do you base it on the dose, or do you base it on the lab?
I don't. Again, it's many for opiates that they're not multiple doctor shopping and getting a ton of opiates prescribed, but they could use that same thing as you allude to in the testosterone world. But I think there would be less interested in the dose that's agreed upon physician to patient, and more interested in this guy's seeing 3 or 4 physicians,
right?
And just doctor shopping, and now he's banking 200 mgs a week here, 200 mgs a week there, 300 mgs, and that now the guy looks all juiced up because he's flying under the radar per physician, but in toto, E-Force would flag that. So I think that's where it really stands right now.
We have that very system here. I can't just go to some random pharmacy and say, hey, I have a script. They're going to put in my name and they're going to see every prescription I have at any other pharmacy. It's all listed. It's a global database.
In Canada, you have that national database that all speak to one another.
Yep.
Because that's right. You got a national healthcare system out there, right?
Yeah. And the funny thing is, I'm prescribed Delatestrol, which is it's a brand of testosterone enanthate, and there's a shortage on the market. And the pharmacy I was getting my stuff from, they said, we're out. There's a shortage. And I'm like, okay, well, I'll go check other pharmacies to see if they have it. They said, no. Controlled substance. We cannot transfer the prescription to another pharmacy. You would have to go see your doctor to have a new prescription written, find a pharmacy that has it, have him send it directly to that pharmacy with instructions of provide said meds, because this other pharmacy doesn't have any. The prescription at the other pharmacy becomes kind of null and void. And this is all controlled. So yeah, there's no way for me. Yeah. Going through a doctor prescription, there's just no way for that to occur. So
interesting. Well, Danny, I want to thank you so much for having me on. It's a podcast and information that resonates dearly with me because I'm going through it now with a change of ownership from a legitimate owner to one that just more wants to run the tea mill versus doing things the right way. All right.
Very good. I hope everything works out for you, Jeff. Guys, lots of really awesome videos coming out, trust me, in the next couple of weeks. If you haven't already subscribed, please do. Click that notification bell so you're not going to miss anything. Jeff, have a wonderful day. Guys, enjoy the rest of your day. Have a good one.
All right. Thanks so much, Danny. Have a nice day.
Thanks.